Hi, everyone, and welcome to our discussion today on lifestyle medicine and nutrition. The Education Institute hosts a variety of educational programs to empower our patients and the community to learn more about their orthopedic health. My name is Heidi Prather, and I'm the host of this webinar. I'm an attending physician and physiatrist at HSS, serving as the founder and medical director of the HSS Lifestyle Medicine Program. I have nearly 30 years of experience in practicing musculoskeletal medicine, including the practice of sports, general musculoskeletal, and spine care. I'm here with my two guests, Caryn Dugan and Griffen. Caryn Dugan is the owner and founder of STL Veg Girl, the Center for Plant-Based Living, and the YouTube channel now that's popular called Doc and Chef. Griffen is a nurse practitioner for the Lifestyle Medicine Program with over 13 years of experience here at HSS. Today, we're here to discuss what patients need to know about nutritional aspects of lifestyle medicine and the impact on the health of their muscles, bones, and joints. We'll cover what it means to eat a whole food, plant-predominant diet, practical tips like reading food labels and important protein sources, small wins patients can do to improve their health, and why these work. So let's go and get to it. So thanks you guys for coming and joining us for this. I think this is going to be really helpful for people to have a way to hear us talk about it, and especially our excitement about it. So Caryn Griffen, nurse practitioner, I'm going to have to refer to you as something like that. Tell us what lifestyle medicine is, because lifestyle is this thing we kind of all think we know it, but what is lifestyle medicine?
So, lifestyle medicine is its own specialty, and it's working with improving your lifestyle to help improve your overall health. So, either prevent disease, reverse disease, and we work with 6 different pillars. We'll go into those more as we talk, but it's its own specialty. So, working to improve your health.
Right. And so Caryn and I are both diplomats of the board of the American Lifestyle Medicine, American Board of Lifestyle Medicine, I'll say that, which means we've gone and done extra training and certification. And it's like a specialty like other specialties are now. But it's really embracing the fact that we have got to get back to enabling people to be in control of their own health. And so those 6 pillars, as you were mentioning, include nutrition, physical activity, managing stress, making sure we have the appropriate social connections that can really help us, sleep health, which we know for our orthopedic patients is a huge issue, and avoiding risky substances. And so those are the 6 pillars that we work with, and they are applied in an evidence-based manner. And it's been shown, just like you said, to prevent, treat, and even reverse chronic lifestyle-related diseases. And those are things like diabetes, type 2 diabetes, obesity, high blood pressure, high cholesterol, cardiovascular disease, some cancers. And we would like to add musculoskeletal medicine to that. The way lifestyle medicine works is the whole focus is on your global health, but we're trying to reduce underlying low-grade, persistent there all the time inflammation in your body. And that's what's at the base of those lifestyle-related diseases, but it's also at the base of musculoskeletal disorders. So it's kind of natural, right, that we should be doing this together. So tell us more about our program, Caryn Griffen, nurse practitioner, and tell us more about how are we doing that here at HSS.
Yeah, so we have a unique program where patients are referred to us, a lot of patients before surgery. We have an indicator, automatic referral if they have a BMI greater than 45. So BMI is the body mass index. And we have an initial evaluation with our patients that are referred. And from there, we discuss what lifestyle changes they would like to make to improve their overall health. It's different for each person. Like I said, a lot of these patients are looking to improve their health before surgery, improve their surgical outcomes. As part of our team, we have a nutritionist. We have an exercise kinesiologist who's kind of a specialist in exercise. We have a health coach. We have a lot of group programming. And we work with the patient to identify what goals they have and work to improve their overall health.
Right. So it's really the reverse of conventional medicine, right?
It's the complete reverse.
It's the complete reverse. Like, we're here to, when I meet with a patient, it's like, I'm here to be your cheerleader, enable you to get to where you want to be, versus you typically in conventional medicine, it's you passively sit here as a patient and receive something from me. And so our healthcare system is not very good at enabling people to be healthy. And part of that lies, part of the incentives within the healthcare system is to do more, do more. And this is the complete flip.
Yeah, it's really refreshing to be able to put patients in the driver's seat and be able to have some control over their own health and empower them.
Right. And we do see a lot of pre-surgical patients, but we also, it's open to patients that aren't surgical. And as the program expands and gets its legs, we're hoping to, continue that track. And patients come to us with all sorts of different problems. Autoimmune disease that we know is managed and can be treated with this method of application of medicine. We see patients with multiple disorders. In fact, 88% of the population right now in our program has 2 or more chronic lifestyle-related diseases, and 26% have more than 4. So there's a lot of help that's needed out there, and I'm very grateful that HSS is really championing this because it is so innovative and novel, and you don't know how it will work out, and it's working out well. But I think we're very fortunate that we're here and able to put this program together. So, yeah. So how we do it is a systematic way. We ask people questions. We go through all 6 pillars of that person's health. And that's where you get the goal making, right? Where it becomes evident what the patient's goals is just by talking through how well do you sleep, and do you feel rested, and what is your nutritional intake look like? Do you think you're eating healthy now? Or all the frustrations around that. So I find it very rewarding as a physician. Group programming I find most rewarding because as a clinician, I feel very pressured in a room, and I know people, if I could just enable them through education, they could push themselves further along. And that group programming really allows us to do that because we have time to present a whole topic, and there's time for discussion, and there's time for community and sharing. So I think, our future really is in trying to grow that avenue. So right now our outcomes are looking good. People are doing well in the program, but one of our big voids that we've had is how to enable people to take control over nutrition, get the right information. And a lot of that's vetted in the inconsistencies we've had in the medical literature on nutrition. So I'd say we're 25 years in now that we have really good evidence of what is good nutrition and what does promote health. And that's eating something that's called a whole food, means whole food means real food, plant-predominant, which means a lot of plants, but not only plants, diet. And that could be rigidly blocked into something like a Mediterranean diet or something called the CHIP program. There's various forms of it, but we try to use that broad umbrella. And one of the things I think we need help with is getting the how-to for patients out there. So hence, we brought in our friend, Caryn Dugan. And Caryn has been, how long have you been in this space? 2008 has been working on getting the message out about nutrition.
Mm-hmm.
So tell us about what you do, Caryn, and where you perceive yourself to help us here at HSS with patients.
Well, just real short, I adopted a plant-based diet. And by the way, I am from St. Louis, Missouri, right smack in the middle of the country, right? So when there's trends or anything new, it comes in from New York, California, and it seeps its way into St. Louis very, very slowly. So in 2008, we didn't say plant-based. We said vegan. And it was, and we've all learned a lot since, but it had kind of this cult following or cult, thing with it. And when I lost my dad to cancer in 2008, and then 10 weeks after he passed away, I was diagnosed with cancer. That really prompted me to eventually look at nutrition. And when I went to Dr. Google, as we do, And I was putting in, it was keen in anti-cancer, immune boosting, all these things. The results that kept generating were a vegan diet, a vegan diet, a vegan diet. And here I am in the middle of the country in 2008, like what? And so I was working in a medical practice, and I wasn't quite sure how to read medical studies and articles. And so I asked for some help, got the lesson, and then it was off to the races. And I was a sponge. I still am, couldn't get enough information because I wanted to know what it was about this crazy vegan diet that was so helpful. So that's where it all started. And then, as I see a lot, and you guys probably see it too, when somebody becomes so impassioned about healing themselves through alternative methods, right? They want to scream it from the rooftops. So I see a lot of people come into this arena, this lifestyle medicine, because they themselves have turned their own health around in some way or another. And it comes from a real deep rooted passion. So I think that's why it has finally taken off the way it has. That, and of course it is, I think Dr. Prather, 2017 is when the first boards were.
Yes.
Yeah.
So it's pretty new as far as sitting for a board certification for it. But yeah, so the message from the American College of Lifestyle Medicine, which is the national kind of organization that helps supply all this education for providers that are interested in, it's a very unique organization because their mission is so forward in getting the message out to anyone and everyone that's accepting of it. And it is evidence-based, which is very different than vegan. So can tell us the difference between a vegan diet, what a vegan diet is and where the history of a vegan diet comes from versus plant-predominant eating.
Well, vegan is, there's vegan lifestyle, and then there's also just vegan diet. So vegan lifestyle comes from compassion. You don't wear animals, you don't eat them, all that kind of stuff. If we were to just talk about food right now, a vegan diet versus a whole food plant-based diet, there are some significant differences. So Oreos are vegan, Skittles are vegan, potato chips are vegan, soda's vegan, right? But that is not going to turn around your type 2 diabetes. That's not going to reverse inflammation. That's not going to make you reverse any kind of chronic illnesses. But the amount of nutrient-dense foods that we're looking for that will do that are from whole plant foods. Okay. Now, just because food is absent of animal products does not equal health. It's just, again, you can have these, pardon me, crappy foods, and you're not eating any animals, but you're not doing yourself any favors health-wise. Okay. So that is the difference.
Right. And so whole foods, the key about whole foods is that, and plant foods, is they contain fiber. And fiber is this essential ingredient that in our gut helps us fabricate these short-chain fatty acids. And the short-chain fatty acids do these really complicated things in the gut that our dietitian explains better than me. But they are the key to health. And so if we don't have fiber, we don't have health. Keep it simple. If you don't have fiber, you can only get from a plant. So plant-predominant is the key. So plant, fiber, health, keep it simple.
And that really, yeah, and I think you're right. When somebody comes up to me and they're like, okay, where do I start? What do I start? And I say, listen, I don't want you counting steps. I don't want you counting points. I don't want you counting calories or carbs or any of that stuff. I want you to count your fiber, and that is it. So, I mean, at the Center for Plant-Based Living, I've created something called the Fiber Formulator, and we very simply stair-step up the amount of fiber that you have every week for a month. I'm a big fan of James Clear from Atomic Habits, and that's kind of what it's modeled after. I don't even want you to feel like you're doing anything different, but you're doing something different. And it's not that you are physically doing a whole lot different. You're just changing your mindset. So it's a behavior thing.
Right. And I think this is, Caryn, you jump in. I think this is a really hard point for patients that are coming in because especially our surgical patients, they're really looking to hit a deadline. I want my knee and I want it by Christmas, right? I need this knee to be working by Christmas, right? Or the New Year's or a holiday or a birthday, whatever, you know? And so they want to hit this deadline. So we are feeding them all this information. It can be so overwhelming. And some of them you'll see will really revert, just give me this really strict thing to follow. And it kind of falls apart a little bit then because that's not really how it works. It's doesn't fall apart, but it's a struggle for those patients. So we need to accommodate them with some outlines, but other people can take the free form and I think we struggle sometimes initially to figure out what that person needs in that moment really quickly, but it becomes evident over time.
It can't be an all or nothing because humans are just not built that way.
Exactly. And so that's where we go into the terminology. I'll use the Esselson's terminology of not being plant perfect. It's about the evidence shows that the more you eat in that direction, the more benefit you get. So I'll give the example. My husband, he calls himself a flexitarian. When I'm at home cooking, he is plant-based. When I'm not there, I'm not sure what's going on. But I can go to sleep at night knowing he's getting 50% benefit simply because he's following it 50% of the time, which is not what we've experienced with traditional rigid diets in the past.
So, Caryn, one of the questions that we get a lot, because a lot of these patients are musculoskeletal patients, they're going for surgery, is their protein needs. How do they get their protein, especially if they're plant predominant?
Yeah. Well, that's the number one question, right? Where am I going to get protein on a plant-based diet, right?
Right.
And I like to say everywhere. All plants have protein. But, if you do enjoy meat every once in a while, hey, okay, but just be aware of, where that is coming from. So I know Dr. Prather likes to talk about fish, for example. So if you're going to be enjoying fish, do make sure that it is wild-caught fish, right? And it's getting the nutrients, actually the protein, by the way, from the seaweed, bottom of the floor of the ocean, lake, whatever, and not farm fresh, where it is being fed feed of some sort, right, that you probably wouldn't want to put in your own body. So, just being on I'd like to say plant predominant diet, and if you're going to enjoy meat, just remember that, yes, you are going to get protein from meat, but you're also not going to get the fiber, which is so beneficial. It really helps cool that inflammation. That is only going to be from plants.
Right. So you can get protein that you need, just plants, but if you want to add in some sources of meat, then just make sure they're healthy sources.
Right. Yeah. And really just, use it I like to say, use it almost as a condiment. It doesn't have to be so much, the big part of the plate, because it is it's pretty dense with fiber. I'm sorry, not fiber, protein and fat. So just be aware of what you're putting in your mouth. That's all.
So tell us about, Caryn Dugan, tell us about some of this, educate Karen Griffen and I on how you talk to talk to people about reading labels to start with.
Boy, isn't that that could be its own course.
Exactly.
It's designed in such a way that it is supposed to be confusing. So, truthfully. So, instead of offering a course to my clients, we just focus on a couple of things. We like to look at fiber, of course. But first things first, let's look at the serving size. If you're going to get a can of soup, let's say a 14-ounce can, and there's usually 2 servings in there. Now, I don't know about you. I'm a big eater, but I am not going to eat half of a can of soup, right? Who does that? Come on, let's be real. So if the serving size is 120 calories, so it's going to be 240 calories for the can, right? So you're going to have to take each one of those numbers down that nutrition label and double it if there's 2 servings, if you're going to eat the entire thing. So immediately, whoops, right? Now, one other thing that I like to look at is if you're watching your sodium intake, and most of the sodium overload that we get is going to be from packaged foods, not the little bit of salt that we're using when we're cooking. What I like to tell people or suggest to people is if you're really looking at your sodium content, make sure that the calories and the sodium are either equal or the sodium is less than the calories you're taking in. Because if that's the case, go for it all day long. I challenge you to find that easily. And when you do, make sure you write it in your phone or on the wall or whatever, so you keep that on your grocery list if that's something that you really enjoy. So that's kind of a little trick on how to know if something has, quote unquote, too much sodium. And it's just, again, fiber. I like to encourage people to get up to 40 grams of fiber a day. People initially look at me like, oh my God, she's lost her mind. But really 40 is just kind of, it really is the starting point. And we're looking at about 12 to 15 grams per person, what they're getting typically in the American diet, which is, you guys know just as well as I do, we have an upswing or an uptick in colon cancers. And wonder why. I don't think that's coincidence, right? That's lack of getting the body moving and getting it rid of food that we've eaten, prescription medicines that we've taken, any kind of toxins that are now food that has become toxic in our body because it's been staying there too long. So fiber, to your point, Dr. Prather, look at the serving size, look at the sodium.
Great. Yeah, and we go through this in group programming, and we go through it in one-on-one sessions with patients because we think the labeling. I think you could talk about some of your noticing some aha moments with patients, but I remember a really important one was. You know what I'm going to say. We're talking about pasta, and we're talking about how to pick a jar of pasta sauce, and if you look at the ingredients and you know where to buy those ingredients in the store, buy that pasta sauce. If there's words there you can't say and you don't know where that item, the xanthan gum, would be on the aisle in the grocery store, don't buy it. It's simple, but you do have to read the label.
Yeah, that's fantastic. I've never thought about that.
We saw light bulbs. We all had light bulbs go on.
Yeah, great advice.
when that happened. So, yeah, I mean, just again, making things really simple, I think, is a challenge because we're giving so much new information to people. And going back again to the reason why with osteoarthritis or a musculoskeletal pain problem that's seated in inflammation, fiber attacks that inflammation. Mm-hmm. And that's what helps not only do your body get better, your global health gets better because you physically feel better. So we have people in our program and our outcomes right now that shows the average patient that goes through the program and completes it, their pain score goes down 4 points prior to getting their joint replacement in their knee or their hip.
That's so exciting to me.
So guess what? If you go into a knee or hip replacement feeling better, it's probably going to go better,
Sure. And they're moving a little bit better.
Yes.
Even before going to surgery.
Yes. So thanks for bringing that up. The majority of patients in our program right now have 0 physical activity minutes. 0. Because they can't move because their joints hurt so much. And so that's why we are so thrilled that if we combine nutrition with an expert, we have Calissa Hall is our exercise physiologist. She's got people literally on their couch moving.
Yeah.
And that's all it takes. You don't have to be grinding it out at a gym. You don't have to be eating perfect. Little steps make big changes. And that, I think, sometimes gets lost in the message because you're overwhelming with people with such kind of new information to them. But again, this is what the scientific evidence has been showing that's been accumulating now for 25 years. And I hopefully it's going to just continue to grow from here.
And it's not just about those little wins, but it's also about celebrating those little wins, right? Because if they're not heard by the patient, then why would you move on, right? My doctor or my community, right? The support group that you guys have, if nobody's recognizing that, because people need that. We all need that.
Right.
We need to know that we're on the right track and that we're doing well.
Right.
Right?
Right.
Because we need to be encouraged to keep going.
Right.
Because in those little moves, and especially those first couple of times, it's like, I don't know if I'm doing this right. Is this really helping me? Like I'm hardly doing anything. And that's just like when I was saying the fiber formulator, like you just teeny tiny steps, and then getting reinforcement from our peers, or our physicians or healthcare providers, knowing that we're on the right track. Keep going, because that builds confidence too.
Right. And Caryn, you're really highlighting what I think is special about the program, and I think why it works so well for the musculoskeletal population of people that need this for health, global health, as well as their, physically how they're feeling, is that it's the simultaneous application of these pillars. It's not just I eating really well, therefore everything's fine. It's not just I got more physically active and everything's fine, because that's kind of what we've known socially, culturally, whatever. That's the messaging we've been getting. You're not exercising enough and you're not just eating right. And we've had, I'll spill another aha moment we've had with some patient. A patient had with me, he was kind of angry, talking with me about, I'm eating really well. I am exercising quite a bit. Look at my number. I didn't lose weight this week. Yes. And I said, you know what? Fabulous what you've just done. Like that's I know we're kind of talking about negatively right now, but that's really fabulous. You've done that. You got those down. There's 4 other pillars over here. Just keep doing what you're doing over here. You don't need to do more. Let's look over here at the other ones. Social connections. For this gentleman, it was sleep. He started really paying attention to sleep, and he recognized the weeks he didn't sleep well, he didn't lose weight.
Right. It's all
right?
connected.
And sleep, when we don't sleep well, we don't repair our body, inflammation creeps up. You can't eat your way out of that. And so I think that's a lot of why this is really working, because like you said, it's a little bit of this and a little bit of that. But I do think, Caryn, please comment on this. I do think the nutrition piece is the part that's really overwhelming for our patients.
Absolutely. Time and time again, we hear that. And having these additional touch points as part of our program, where they can celebrate these little wins and they're putting the pieces together,
right,
really brings them to a healthier level.
So bringing Caryn Dugan on, we're going to have cooking demonstration, which I think is a big, exciting, oh my gosh, we need it piece of our program. And tell us about the aha moments people have, or what happens during cooking sessions where you see people get that light bulb on or get excited. Give us
There's been so many.
Yeah, just give us a favorite.
Especially because they're doing it. They're in the middle of doing it, I mean, so our members I do one cooking class a month with them, and they're virtual, they're through Zoom. And I always encourage people to cook along with me, because they are then using their own kitchen, their own resources, their own home to make health improvements for themselves and, of course, other people under the roof. So when you're cooking with me, or when we're cooking together, I should say, and class is over, dinner's on the table, that is a big win, right? That is a huge win, and then everybody gets to, hey, Mom, this is great. Or, hey, Dad, you did a fantastic job. I love this, and then you're getting reinforcement from your family. And then everybody in the family is eating that food, hopefully, those, we could talk about that later. But so that's a huge thing for me, and it's amazing. Like Heidi, you were saying that, like, there's so many people in the program that, suffer from different chronic illnesses, not just 1, but 2 and 3. And that's really the beauty of a whole food plant-based diet. And of course, just lifestyle medicine in itself is that it's not just one diet for one disease, right? Trying to stop the recurrence of breast cancer and reverse your type 2 diabetes and reverse inflammation and reverse heart disease. Those are not different diets for different conditions or diseases. That's one quote unquote diet, and it's called lifestyle medicine. And that in itself is why it's so beautiful. And it's okay if you're not doing all the things all at once, little by little by little, right? Just little by, and of course we all get it. Like the harder you try, the luckier you get, right? I got it. But you're not going to go from 0 to really lucky in one day.
Right. And the other thing that, your center, the Center for Plant-Based Living, and Doc and Chef are going to really help us with is that when we make behavioral changes as humans, we're all humans, we make changes and then we can kind of slip because of stress or this, the plumbing went out. All those, the life things that happen that get us off course, you get overwhelmed with just life things. And so we have to expect that we're going to kind of revert back to some habits that may have been just easy, right? Because you do have to be conscious of what you're doing. And so we're really hoping that the Center for Plant-Based Living can be a really good place for people to land, even after they've graduated our program. Where you're like, oh, I need a refresher. I need to get enthusiastic again because my kids are whining that I don't have enough potato chips in the house anymore, and that kind of thing. I really hope that that's a service that our patients can utilize because it's lifelong learning.
It is.
I mean, in the pandemic, I was a member of Caryn's program, and in the pandemic, I was in one city, and my best friend was in St. Louis still, and we both would join her cooking class, and we put you on mute, and then we were yabbering about what you were yabbering about, and it became a very socially wonderful thing, and I think people can do that. So thanks again for being with us today, Caryn Dugan.
Thank you.
We're so excited to have you on board, and thanks, Caryn, for sharing your stories. And we're grateful again to HSS for promoting this program and allowing us to provide it for patients is already having impact. And I think we have many more places we can extend this help. So that's all we have time for today. Thank you again for tuning in. And if you have any questions or want to learn more about HSS, feel free to visit us at hss.edu or check out our webinars on our YouTube playlist.